Mental illness is a growing global concern, but how we respond to it isn't universal. So our cultural values shape how we talk about mental health, whether we seek help, and how care is delivered. So in this presentation, I'll be using Hofstede's cultural dimension theory to compare Canada and China. Specifically, I'll focus on two dimensions: individualism versus connectivism and power distance. This concept helps us understand why people in different countries experiencing mental health so differently. So first, I'm going to talk about Canada. Canada is more community-based and it is more open approach. So Canada's mental health system reflects strong individualism values. So people are more encouraged to take responsibilities for their own well-being and seek help when needed. And thanks to those public funding, access to therapists, psychologists, and social workers, they are widely available. And family doctors are often served as the first point of contact. And they have campaigns like Bell Let's Talk. They aims to reduce stigma by promoting open dialogue. And all of these shows that Canadians' culture it is acceptable and even expected to talk about personal emotions. It is a society where mental illness is treated as a health issue, not a moral failure. And next, I'm going to talk about Canadians' culture and power dynamics. So Canada is a low power distance society. So in Canada, the relationship between doctors and patients is pretty equal. Doctors aren't seen as people you just blindly follow. They are more like partners in your care. And patients are empowered to ask questions, express preferences, and participate in decisions about their care. And this flatter hierarchy helps build trust between patients and providers and makes mental health service more approachable. According to Statistics Canada, nearly half of people with mood, anxiety, or substance disorder reported taking to a health professional in 2022. So this high number doesn't just mean services are available, it also shows that people feel okay asking for help because the culture really supports it. Now I'm going to talk about China, which is a family-centered and stigma system. So in contrast, China's response to mental health is shaped by connectivism and respect for social hierarchy. So mental illness is often seen as a threat to family honor. People may hide their symptoms to avoid bringing shame or appearing unstable. This silence isn't due to lack of need. It is a result of cultural pressure. And in China, emotional struggles are kept private for the sake of group harmony, and seeking mental health treatment can be viewed as selfish or even as a disruption to the social order. Now I'm going to talk about barriers from culture and hierarchy. So China is also a high power distance society. That means patients are expected to defer to doctors or family elders when they are making their health decisions. So in many cases, a psychiatric treatment cannot proceed without family approval, especially when hospitalization is involved. Even when mental health services are available, cultural stigma and family control often prevent their usage. There's a nationwide study between 2013 and 2015 found that only 9.5% of people diagnosed with depression received any treatment, and more seriously, only 0.5% received adequate care. And this under-treatment gap reflects the influence of shame, hierarchy, and their influence to stop people from seeking medical help. So now I'm going to compare Canada and China. So I'm going to compare in six categories: the cultural dimension, power distance, mental health attitude, help-seeking behavior, the role of the family, and self-service access. So first, we can talk about Canada. Canada is high individualism and it is low power distance. So mental health issue is more seen as personal issue. So like individual, I mean the people, is encouraged and it is seen as responsible to seek help. And the family is more supportive and they are not controlling. So that makes like the service access is widely available and everyone can use it. But China is totally the different story. So China is high connectivism and it is high, power distance. So that makes like people like individual with mental health issue, they are seen as family or social burden, and the way of seeking help is discouraged and it is seen as shameful. And the role of the family is not support, but it is central and it is control the decision making. So the service access, I would say, even though it is available, but it is highly under usage. Culture doesn't just influence what people believe about mental health, it shapes how they act. So in Canada, high individualism encourages people to speak openly about emotions and seek help in their own. But in China, the focus is on family harmony. People might hide their strugglings to avoid disrupting the group or bringing shame to the family. So power distance also matters. In Canada, patients and doctors often work together, but in China, patients may feel they just follow what authority figures say. They can't question the others. And when it comes to stigma, Canada worked hard to reduce it through national campaigns, while China, saving face is still very important. Some people, so people often keep silent. So all of these cultural factors deeply shape how mental health is understood and treated in each society. From this comparison, we learn that mental health strategies need to fit the cultural context. Like open conversation and self-advocacy, this works perfect in Canada, but it will not work in countries like China. And like China is where stigma and family influence are stronger. And for countries like Canada that service diverse populations, it is important for healthcare providers to understand different cultural backgrounds. Some patients might feel shame or fear around asking for help. So cultural sensitive care means more about offering service. It means building trust, involving families when needed, and respecting each person's values and beliefs. Culture doesn't just affect what people think, it shapes whether they can get the help they need. In conclusion, Canada and China illustrate two different models of mental health care, each rooted in its own cultural logic. Canada's high individualism and low power distance promote openness and personal control. China's connectivism and high power distance reinforce family centered decision and stigma. As our societies become more diverse, understanding these differences will be essential, not just for mental health professionals, but for anyone who wants to promote inclusion, dignity, and care for all.